Dr. Garima here, pediatric dentist, and today I'm sitting here with our handsome clinic manager, Mr. Rian from South Africa. And it's been quite a while that he keeps on asking me the silly questions about why baby teeth are important and what do I actually do in pediatric dentistry. So I thought might as well bust some of his myths. So hi Rian, how are you doing?
Hi doctor, good morning. And as Dr. Well said, my name is Rian. I'm the clinic manager at Through Smile Works Dental Clinic. So thank you for joining us today, and rightfully so. I do have some myths. Would you like to bust them today?
Yes, of course. I would like to punch them out.
Amazing, amazing. So before we get started, would you like to give us just a bit of a brief background just in terms of who you are?
Yeah, sure. Like I said, I'm Dr. Garima here. I'm from India, practicing in Dubai since past 7 years. I am practicing exclusive pediatric dentistry, which means I just deal with kids. And yes, I still manage to have all my fingers intact, so I'm good at that. So yeah, that's about me, and we'll start answering few of the frequently asked questions that today's parents must know about what's happening in their child's oral cavity, correct?
Okay, so are you ready for us?
Yes, I am.
We've got a couple of questions itself taken from a survey from a couple of parents. And like I said, if you'd like to help us out. Yes. First question of today. Are cavities irreversible?
Are cavities irreversible? I would like to show this question.
Is our question.
Yes. See, what are cavities in the first place? Cavities in layman terms are holes over the teeth. I'm sure one of us each may have had it at some point in our time. Like especially we realize when some food gets stuck and we are trying to remove but we can't. Cavities happen in adults as well as in children's tooth. So just to give you a brief explanation about it, this is a tooth. If I cut it into half, you see the different colors out here. The first layer is the white, which is called as the enamel. Now when the cavity is in here, it's actually reversible, meaning you don't have to actually come to a dentist and fix it. The problem is you don't realize when it's in the enamel because it's not hurting you, and neither the food is getting stuck at the time. So if you don't go for a regular checkup, that cavity is going to progress into the second layer of the tooth. At that point, it becomes irreversible. Then you need a filling. So my advice, go for regular checkups so that when you find a cavity, the dentist would find it for you and show you. They will give you options how to reverse it back, and you may actually prevent your tooth from getting filled and save a huge amount of money as well. So yeah, cavities are irreversible if they reach the second layer, and the first layer you can reverse them.
Okay, so you've heard it from doctor. So I would suggest give us a call, book it now, get the cavities out the way. All right, doctor, thank you so much. Our second question from our viewers. Baby teeth are not important.
Baby teeth are not important?
I'm trying to see whether I should say it as a statement or a question. Are baby teeth important?
Of course they are. I'll tell you why. The most important thing, first of all, speech. Teeth are required very much for speech. Secondly, how is your baby going to eat if there are no teeth? You know, it's nice to have babies without teeth until the age of 6 months, but once they grow, just imagine your baby not having a tooth at all. What about that beautiful smile? Oh my God, you need to have nice smile. Imagine Rihanna, I knock off all your front teeth. How would you smile?
I like that.
No. So for speech, for aesthetics, for chewing, the most important, you would love to feed your baby. How would they eat? So baby teeth are very important, and there is a reason why they fall off from age 7 onwards, because they maintain the space for the new teeth. If you lose a baby tooth early on, the new tooth does not know from where to come, and it may come in a wrong position. So they act as a natural space maintainer. So yes, of course they are important.
Okay, so to all the mothers out there with babies, including myself, I'll make sure of that. Thank you so much. So third question as we move along. What can you do to protect your teeth at home besides fighting with your siblings?
That's true. Very important question. Often I've been asked this question, doctor, what should we do and how do we take care? Well, you know what? Toothbrushes are great for starts. They are the most simplest and the cost-effective method. You have to brush nicely for at least 2 minutes. A 10-second brushing won't do the job. It's okay if you don't want to use a toothpaste. Yeah, that's right. You can just use water, but brush nicely. The teeth are very hard structures. Just plain cleaning them is fair enough. When do you have to clean them? After every meal if possible, or at least rinse your mouth. So these are the simple things that you can do apart from applying fluoride and GC tooth mousse, which we come on to later on. Okay?
Great. Thank you for that once again. Oh, this is an interesting one. So, because of milk teeth falling out at a younger age, would you recommend braces after the age of 14? And can you tell us a bit more about why?
So braces only after the age of 14? Well, in the normal population, if all of your new teeth have come out and there is just mild crowding, they're just a bit crooked here and there, you can of course go for the braces after the age of 14. But there are many situations where from the age of 7 you can actually see and find that the new teeth are not coming in the proper position at all. They are extremely crooked or they are in a very wrong position. You can actually start braces from the age of 7 onwards. That is not the final stage of braces though. We call it as phase 1 treatment, which would just help in growth modification and aligning of few of the teeth so that in future it's not so severe and won't require an intense treatment. So braces can be started at the age of 7, and not only braces, there are some growth modification appliances that can be given as well. So yeah, you must visit the dentist every 6 months and know more about your child's teeth.
Absolutely. I couldn't agree more. And like doctor said, visit us today. Second, milk tooth. What will happen if your milk tooth are lost at an early age?
What will happen if a milk tooth? See, unless your child happens to have some underlying medical condition in which the milk teeth are lost for no reason before their time, then we must investigate that. But if the child is normal and doesn't have any issues and the milk tooth is falling off early, that means the new tooth doesn't have a proper space to come out. So it's making the milk tooth fall off early than natural. That is another sign that you're going to go for braces in future, or the teeth are not coming in the right position, which would cause crowding issues, cleaning issues, speech issues. So it's not good to have a milk tooth fall off early.
Okay.
Yes.
So yes, regular checkups with Dr. Garima. I highly recommend it. My child was playing and knocked one of his toothy fell out as he was playing.
And what did you do about it?
So the first question was panic. I stopped and I realized that instead of panicking, let me ask Dr. Garima. So,
see, often you must find a condition, or you may have heard that a child is playing in a playground or at home, he falls and the entire tooth comes out of the mouth. It's a very delicate situation, because first of all you are panicking as there is blood, as there are cuts and there are wounds and the child is crying inconsolably. It's okay. The oral cavity bleeding looks a little more and gross, but don't panic. Immediately as you find the tooth, especially the permanent tooth, you will take milk. Anywhere you are, just take plain cold milk, put the tooth inside it. Do not wrap it in a towel, do not wash it anywhere else, do not just discard it, because within the first 1 hour, if we can put the tooth back inside the mouth, it stays. You don't have to go for any other artificial replacement and cause, stress or psychological, a thing to the child. You can just put the tooth back and the tooth would stay. So anytime you see anybody else knocking off a tooth or your own child, just put in the milk and rush to your nearest dentist. You can save that tooth.
Amazing.
Yes.
Okay. Moving on. Let's get a bit more serious when there's a bit more pain involved for our kids. Root canals. So, can a root canal be done on milk teeth?
Yes, of course. Many parents ask this question for children aged 2, 3, 4. Doctor, can root canal be done on a milk tooth? Yes, it can. What is a root canal? A root canal basically means when the infection has gone inside the nerve of the tooth, you can treat it. So the word itself, root canal, meaning there has to be a root for us to do the treatment. So we take an x-ray. If the roots are really nice, for example, the child is 4-year-old and the parent has come because the child is having severe pain, there is an abscess, but the root of the tooth is really nice and the tooth is going to fall off when the child is around 10 years of age, we recommend to save the tooth. Yes, there is an option of removing the milk tooth, but when you save the tooth, it acts as a natural space maintainer. Yes. You don't lose the tooth, you have a tooth to eat, speech, aesthetics, everything. So yes, root canal is very, very possible in the age group of 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Another new one. Other than for our little princesses, crowns are not only worn on top of their heads, But can you tell us the importance of why crowns are needed on milk teeth as well?
Absolutely. Apart from the very basic thing of doing a root canal, which weakens the tooth structure because you remove a lot of cavity and the tooth walls become weak, we do a filling and give a crown to protect it. Crowns are also given in a condition called as hypoplasia. Now, many a times, due to some metabolical reasons, the tooth structure has not developed properly, the permanent tooth structure. So when they come out in the mouth and you're chewing on them or you're brushing them, the layers of the tooth keep on just going away, which causes a lot of sensitivity, and you don't want that tooth to reach the stage of root canal. So you give a crown to protect them. So crowns are given as a protective measure and also to save a tooth from fracturing after the root canal procedure is done. We have silver crowns, we have white crowns. So it's up to you what you would like. Children prefer silver crowns. They feel happy. They feel like you're Iron Man.
Amazing. So any sort of crowns that you are looking for as well, you heard it from Dr. Garima at True Smile Words. So visit us today. Another question we get quite often is that, how do I get my child to clean their teeth?
Very good question. I know there's a lot of struggle when your children are toddlers, 2-year-olds, 3-year-olds. They keep on running here and there. They don't open their mouth. One of the very fascinating methods that I've found is when you go to brush your teeth, you carry your child in your arms. Take them to your washroom, give them your brush and ask them to brush your teeth. So when your child is brushing your teeth, they find it very funny and interesting. And once they are done brushing your teeth, you take the child's toothbrush and brush your child's tooth then. So then they will allow, because they have brushed your teeth. So it's like a game, you know, you brush mine and I brush your teeth, like that. So that way the children would allow you to brush and it would be a nice family time happening. So that is how you brush your child's teeth.
I actually have a to-do list and I have quite a few things to do when I get home. Thank you, doctor. Black stains. We all know it's a bit scary when our child, because we don't know what's going in the mouth. So what happens when our child has black stains over their teeth? What should be done?
True that. Now, black stains can be due to two reasons. One, if your child is taking iron supplements causes black stains and they are very stubborn stains. Unless they become really aesthetically unpleasant, you don't have to do anything about it. Another variety of black stains are called as chromogenic bacteria. Now, what are chromogenic bacteria? These are the bacteria which are present in our mouth, but when they grow, they produce colors. The colors can be black, green or orange. Again, they are very stubborn stains. If they become very unpleasant, you can come here for a cleaning. We can clean, but the stains come back within 2 weeks or so until all the new teeth are out in the mouth. But the good thing about those chromogenic bacteria is that I have frequently found that children who have these black stains seldom have any cavities. Because these bacteria don't give place to any other bacteria in the mouth. They occupy the place, produce stains and keep the harmful bacteria away.
Interesting.
Yes.
Okay. I'm learning a lot today. I hope you are too. So we spoke about my child brushing my teeth. We spoke about how it is that they'll be able to copy me and how it will help me with the process. So if my child is 2 years old,
Correct.
how do I brush them?
Very good question. Now, that is why I've kept a soft teddy bear out here to show you how to brush the teeth.
Hello,
now,
Paddington.
We sit in a knee-to-knee position like this.
Yes.
One parent would be holding the hands and the legs of the child. The other parent has the mouth access.
What?
It's okay. We take a brush and then we start brushing. So this way the child feels very comfortable because he's looking at one of the parent at all the times, and you have the full access to the mouth and you can brush very nicely. So this is how you brush for a 1-year-old and 2-year-old.
And we can have stretching time.
Yes, exactly. It's a fun time.
Okay, moving on. So stretching time is over. Our kids are smiling. Everything is good. How do I control the number one factor as to why we visit the dentist? Candy. Sweets.
Yes.
Tell us more, Doc.
Every week there's a birthday party. Every now and then a relative comes over and hands over sweets directly in the hand of the children. How do you avoid it? Well, you can't. You definitely can't. But there are some certain things which we can do to prevent cavities from happening because of these sweets. We don't want to take away sweets from your child. We want them to enjoy. But how do we do that? So we start inculcating a habit, which is what I do with all my patients. I tell them, take a jar, write your name on it, and whatever candies you get, put in that. You will open that only once a week. I think this is a habit which we should also do. Like for example, choose Saturday. All the sweets are to be eaten only on Saturday. The rest of the time, have the self-discipline, put in the jar and make it a point. In front of the child also, you should also say, you know what, this is a sweet and I won't eat because it's not Saturday. That way the child understands that they will get the sweets but only on one particular day. So you minimize the intake of sweets throughout the week, and as soon as they are done finishing eating their sweet, brush. So that way you can enjoy sweets and maintain your teeth.
Can I apply that same process to my partner? Maybe. All right, so thank you so much. And moving along, would you like to show us what is the best possible way and action for kids in terms of brushing?
Sure. In children, because they just have 20 teeth, you can just take a brush and do a circular motion like this. It's called as a Phone's method, the scientific study. But then it's very simple. You just do a circular motion up and down. Ask the child to open the mouth, brush horizontally and up and down in a horizontal and then vertical motion. It should not take you more than 2 minutes to brush, and ask them to rinse vigorously after that. So a simple circular motion with a very ultra soft or a super soft toothbrush is required for brushing. You should never use a hard, a medium or extra hard toothbrush. They just remove the layers of the teeth and cause abrasion and then sensitivity. Even for yourself as an adult, use always an ultra soft and a super soft toothbrush.
I agree.
Yes.
Great. And lastly, but not least, tooth mouse diary allergy. It's a mouthful.
Yes.
Tell
So, tooth mousse. See, the adjunctive methods to prevent your teeth from having cavities are fluoride. First of all, you should always come to a dentist to apply fluoride once in 6 months because they protect your teeth. Another way of protecting your tooth is applying tooth mousse. Tooth mousse is a very patented formula by a Belgian company, and it's produced in Europe. It's called as GC Tooth Mousse, which you can just apply all over your teeth and leave it there. It is pure calcium, so it helps in remineralizing your tooth structure. But you should always be aware, because it's calcium, you should not be giving to children who have dairy allergy. So make sure of this, and that's why we have this question here. Anybody cannot use a tooth mousse. Only children and adults who don't have dairy allergy will use it. So that's about it. If you take care of all these methods and follow what we have said, and I hope this presentation has given you a lot of good information and busted few of your myths. I hope it's busted your myths as well.
It has quite a bit. I actually do have one last one actually.
Yeah.
I still have my tooth under my pillow. Where does it go?
Or maybe the tooth fairy didn't visit you yet.
Because Dr. Karima is our tooth fairy at True Smile Works Dental Clinic. So, visit us today with all your loose teeth, milk teeth, mousse teeth.
And for a happy experience.
So, thank you for joining me.
Thank you so much. Bye-bye.